Children are not just tiny humans. Children's anatomy varies so much, so let's look at some key anatomy differences. The first one is the respiratory system or the lungs. Let's say this is an airway. This is a healthy airway in an adult, and this is a healthy airway in an infant. Normally, we have a healthy and open airway where oxygen can flow. You can clearly see that infants have much smaller airways than adults. Now, the issue comes into place when we have edema or swelling. Here you can see edema and swelling does block airflow, but it's still allowing it to go in and out. Where here in an infant, edema is very serious. We almost have complete blockage. Next up, we're going to look at the difference between adult ears and infant ears. This is a picture of an adult ear. You can see that the eustachian tube is slightly tilted, allowing for drainage and are less likely to harbor bacteria. Now let's compare this to an infant's ear. You can see how the eustachian tube is shorter, wider, and flat. Since it's flat, this does not allow for proper drainage, which can cause secretions to sit there harboring an infection. Next is the musculoskeletal system, or our infant's bones. It's really important to know that the bones are not ossified yet in children, meaning the bones are more flexible and flimsy. Infants' bones typically bend rather than break. We call this a green stick fracture, or when the bone is partially bent. This is the most common fracture seen in children. Think about it. If we have a stick and we bend it, it's just going to break and snap immediately. There's no room for bending. That's like an adult's bone who's been ossified and it's hard. But if we have a flimsy straw, aka a non-ossified bone, you'll see that it bends, not breaks. Again, this is called a green stick fracture and it's seen in children. If you're taking pediatrics class in nursing school, I have two resources for you. The first one is the pediatric flashcards. Flashcards specifically for those who want to ace their peds class in nursing school and truly understand the concepts. And the complete nursing school bundle, which has an entire section dedicated to pediatrics. Best of luck in nursing school and happy studying.